My name is Abdullah Hassan Pratt. I'm an emergency medicine physician, and we're going to talk about how to recognize and respond to a stroke. A stroke is a blockage of blood or nutrients or an excess of blood bleeding into the brain. This causes permanent effects going forward in your speech, the way you move, or the way that you think. The thing that I want you to remember is FAST, F-A-S-T. You want to act fast because that saves someone's life or their function going forward. But you also want to remember the F-A-S-T means face, meaning you want to recognize facial droop. You want the arms, meaning you want to see if one of the arms isn't working well. Speech, you want to have them repeat a sentence, and if they're slurring or they can't understand things, T means time call 911. So face, you'll see a face droop. Arm, you have them hold out their arms if one's droops. That's a point. Speech, have them repeat a sentence. T, time to call 911. Hope this helps you in an emergency one day. Thank you. Hello, my name is Abdullah Hassan Pratt. I'm an emergency medicine physician, and today we're going to learn a little bit about CPR. So, once you get to a scene, someone's collapsed, you don't really know why, you want to try to arouse them.
Sir, is everything okay? Is everything okay? Sir, are you okay?
Try to see if you can wake them up, see if they're breathing. You can perform a jaw thrust to help them breathe. If you still don't hear any breathing and they don't have a carotid pulse, you want to immediately start chest compressions. You want to lock your fingers, lock your elbows, and you want to really use those core muscles to compress just over the sternum at a rate of about 100 per minute. That means that by the time you get to 2 minutes, that's one cycle. Now, if there's someone else around, you can delegate the task and ask someone else to call 911.
Someone call 911, please.
Also ask them to find an AED or defibrillator.
Alright, call 911, get the AED.
If that isn't around, you want to call 911, place it on speakerphone, allow them to know what's happening, and then they'll be able to direct you on to when you should go look for an AED. Thank you. My name is Abdullah Hassan Pratt. I'm an emergency medicine physician, and today we're going to learn a little bit about how to use an AED defibrillation device. The times when you're going to need to use these are when someone has collapsed, they may be in cardiac arrest, they may have just had a heart attack, and the only thing that's going to take them out of that fatal arrhythmia or irregular heartbeat is going to be one of these devices. Now on TV you see them with the two big paddles and they shock people. Nowadays they come in a nice discreet packet that just has some pads. If you just open it, follow the instructions, you should be okay. But also by this point you should have called 911, and they can also reinforce these steps and walk you through what's needed to be done. So the first thing that you're going to want to do is you're going to want to open the AED device, take it out. Follow the instructions. Remove those clothing.
Open packet and apply pads onto patient's bare skin.
Now these pads have two different indicators.
Apply pads as shown.
One is going to go here, the other one's going to go there. Now at this point you would have just applied the pads to the patient's chest, as in the case right behind me, and you're just going to follow those prompts from start to finish. Let's go through them one more time.
Do not touch the patient. Analyzing heart rhythm.
Now it's checking the heart rhythm.
Do not touch the patient. Analyzing heart rhythm. Shock advised.
So as you'll see, this red light will start
Press the
flashing.
flashing shock button.
At this point, you're going to tell everybody all clear.
Press the shock button now.
Clear, shock.
Shock delivered.
That person's going to have a small
Begin
jolt.
CPR.
And you just follow the instructions. You go back to doing CPR. The machine is going to then count how many times you've done those compressions. It's going to then instruct you to pause again, and it's going to do that same process all over again. If this works, people sometimes wake up, but nevertheless, follow the instructions until help arrives, until those paramedics come, and then they will take over for you. Thank you. Hello, my name is Abdullah Hassan Pratt. I'm an emergency medicine physician, and today I'm going to be teaching you all how to deal with a gunshot wound, stabbing, or any other kind of life-threatening bleeding. Right here we have a mock of someone's leg. We also have a tourniquet, and we also have some gauze. First thing you want to do when you get to a scene where someone's been shot, make sure the scene is safe. You want to then see what kind of injury is there. Tell that person that, hey, I'm a medical student, I'm a lay bystander who's trained to this, I just want to help, is that okay? Sometimes those people aren't awake, sometimes they're not. Now a chest wound, head wound, there's very little that you can do about that, but in the leg wounds, arm wounds, those are things that people can die from bleeding but you can prevent them if you know what to do. So the first thing you want to do is find the injury. Well, in this case, you have a couple of injuries here as well as here on someone's leg, and you can imagine this leg is sticking out into you, into the screen. And so the first thing you want to do is try to remove that pants leg, that dress, whatever is there, while also keeping some discretion. If you do nothing else but this, you may save a life. You want to apply pressure where the bleeding is coming from the most. If there's bleeding that's pooling, if it's soaking a pants leg, any of those things, it's life-threatening. You apply pressure with both of your thumbs right over the wound while also making sure you're not cutting yourself on sharp bones, glass, etc. If you have anything, a t-shirt, sock, your maxi pad, anything that could soak up blood as well as create a barrier so that you're not cutting yourself, use that. If you do nothing else until help arrives, until a paramedic arrives, after you call 911, you may in fact save a life. But if you have multiple wounds or the scene is too dangerous and you have access to a trauma kit, we'll teach you how to use those elements of the trauma kit. The first thing that you can see here that we have is a cat tourniquet. This cat tourniquet is just a strap, a pin, and a hook, and it's pretty self-explanatory. I'll show you with this one that we have here. First thing you want to do is identify it, make sure that you know what parts of the tourniquet are there. This is the Velcro strap. This is the pin that you'll twist. This is the loop into the hook that you'll do to kind of secure this whole thing. You want to pull it over someone's foot. You want to start here, pull over, and you want this above the wound or closer to the heart by 2 to 3 inches. Once you have it there, also have the buckle right on top of the wound so that you can see the buckle and the wounds at the same time. You want to take this Velcro strap. You want to pull it as tight as you possibly can on the first go round. Strap that down and bring it around. Now you want to tell people that this is going to hurt. This amount of pressure always hurts. Unstrap here, twist the pin either way, doesn't matter. Try to use both hands if you can, and you want to twist until you can't twist anymore. Twist, twist. This often takes a lot of twisting, and you want to not stop until the bleeding has stopped from these wounds. This would account for both of these wounds because the heart has to pump blood past this point until the wounds. So by doing this, you're cutting off that blood supply. Here, you're going to strap over. These can stay in place for 1 to 2 hours without risking someone losing their leg. The next thing that you can do, you can also pack a wound. So here we have some quick clot combat gauze, and you can pack this wound as well. You want to start with one end of the packing, and you want to pack until the entire packing is in that wound and there's no more bleeding coming from it. Whatever you have left, you can hold pressure with until help arrives.